I'm Dr. George Isham. You should have seen me this morning, but you didn't because I had a journey in terms of getting here, and I understand that the power of stories is important to the movement kind of situation. My story is that my airplane was delayed at first because of weather in Salt Lake City, and then because of a mechanical delay, which caused the airline to put me up in a hotel. And then this morning because of delays, but fortunately all the planes this morning were delayed, so I ended up here this morning. So in this role of doing this summary session, I spent the lunchtime being antisocial and looking at the video of the earlier presentations so I could hopefully effectively chair this discussion. So our purpose in this discussion is to work. We are not going to sit back and relax. Each and every member of the roundtables assembled has now a job to do. I know we're a small but hardy group. And toward the end of this session, I'm going to ask each and every one of you to come to the microphone. So nobody can sit back and you're to answer 3 questions, which our distinguished panel is also going to help get the ball rolling in terms of answering. 1, how did the day's proceedings change what we do? 2, what would a social movement focused on generating broad public support for, investment in, and policy directed at improving population health and health equity look like? What would a social movement focused on generating broad public support for and investment in and policy directed at improving population health and health equity look like? What would it look like is the question. What is the basic framework or key elements and how do we get there? And then 3rd, what advice for the roundtables on filling the existing gaps and overcoming barriers? We came here together in this conversation to learn about movements, but not for the sake of the movements discussed, but so we could take that learning and apply it to the dialogues that each of our respective roundtables convene for the purpose of creating change to create a healthier country, healthier individuals, and a more equitable and just society by addressing reduced disparities and inequities. So that's my summary. And so that's the charge to you. So I'm spending a little time making sure that you have a few moments to think about that, because I think each and every one of you should come to the microphone and talk about that. Now, before I introduce this panel, I'd like to read to you a quote. No one is born hating another person because of the color of his skin or his background or his religion. People must learn to hate, and if they can learn to hate, they can be taught to love. For love comes more naturally to the human heart than its opposite. And that quote is from Nelson Mandela, who we have some news this afternoon, which I know many of you know probably. It just passed away this afternoon. I know no better way to set the context or the challenge for the work we've got in front of us than to acknowledge that fact here today. So let's just take a moment to reflect on that individually. Thank you. So with that challenge and his inspiration, that makes our task all the more important in this section, right? So in order to get that ball rolling, we have an excellent 2 people. We did have 3, but now we're down to 2. One of our members of our panel, unfortunately, could not be with us. But we have Jeff Levy, who's the Executive Director of the Trust for America, member of the Population Health Improvement Roundtable, and his full background and biography is in your materials. And Jeff has been a leader, and I look forward to hearing what he has to say in response to those 3 questions that I laid out for all of you. And then Sandy Magnan, who's the President and CEO of the Institute for Clinical Systems Improvement in Minneapolis, Minnesota, and a member of the Population Health Roundtable Improvement. And so these two will begin our discussion. And we have this lighting system, and we're going to have to adhere to it if we're going to give everybody a chance to get that. So I will encourage us to adhere to it. Jeff?